Welcome back. Health and education. Two important priorities in front of our political leadership. The state is exerting the utmost efforts to present a remarkable service in those two fields in specific. And there are many efforts exerted on the ground to make this a story of success. Whether it's the infrastructure, whether it's the qualified cadres, whether it's the good management, all this and more. So let's discuss this together, and we do have an expert who is going to answer all our questions. We are very much delighted to have with us Dr. Magdy Adly, a senior manager in hospital management and quality control management. Thank you very much for being with us, sir.
I'm so appreciated to be with you tonight.
And let's start with what I've said regarding health and education, and of course with your presence we are going to focus on health as one of the priorities and one of the important fields which really witnessed a leap in the past decade at least. Tell me your opinion, or how do you see modernizing our infrastructure in this field, building new hospitals and qualifying our cadres to lead these medical institutions?
First of all, thank you for your beautiful introduction. And first of all, you're supposed to come back before 2014, before Mr. President has the leadership of the state. So health regime, in fact, was very bitty. And there is no good hospitals, there is no medical education, there is no and in fact the patient or Egyptian citizen suffering so much. Then when the Mr. President come to as a leadership, he put his the education and the health sector on the priorities of his agenda, and starting little by little, and he was faced that he and Egyptian citizens can do the job and can challenge and do their best to become or to have a better lifestyle. And then we saw that we start with some big problems like epidemic diseases like hepatitis C epidemic disease, and all of us see the efforts which have been done with the government, not only, by the way, Ministry of Health, but also all institutions of the state, under the supervision of His Excellency, and how we eliminate that hepatitis C, and even WHO appreciates that and
I think we entered Guinness record because of that.
Yes.
So also, I think the modernization of our infrastructure and qualifying our cadres led to the launch and expansion of the Universal Health Insurance System, or the UHIS. If you want to elaborate on that too.
Yes, thank you for that question. To apply, or to in advanced countries, to apply something like health insurance system, you're supposed to have very good infrastructures containing very good infrastructure of hospitals or clinics or any health units to provide a good health services to citizens. And that was clear for Mr. President, for the government and the Minister of Health. So they are planned since 2015, by the way, for application of health insurance, comprehensive insurance system. And the actual application was by 2018, and we applied it in 6 governorates we applied already in 6 governorates, and we measured the satisfaction of our citizens there, and it gives a very good feedback for our Egyptian citizen. Then we come to the another stage of health insurance system, which contains another 5 governorates. They make very good infrastructures, including the infrastructures of hospitals, of clinics, and even the HR, or human resources, including even the medical team, and continuated education of medical
of course.
education.
And sir, all this, I think it was really such a contribution to the success of 100 million صحة, or 100 million healthy citizens. Here in this initiative, this presidential initiative, which was very ambitious, it really succeeded on the ground to eradicate a lot of illnesses or diseases, and to decrease the sufferings of many sick people. How do you see the success of this initiative, sir?
This is a good question. Look, presidential initiatives, in fact, was a very quick solutions for a problem which must be solved immediately. So, Mr. President, make that presidential initiative to solve these problems. And if you count these presidential initiatives, you found it like 14 presidential initiatives, including hepatitis C elimination, including
women's health, students at schools,
100 million health initiatives, including the women and fetus initiatives, including waiting list elimination, including the scholar students and elimination of anemia, including the rapidly discover of currently diseases like hypertension or diabetes or obesity. And by the way, these 3 main diseases contribute for 70% of mortality. So when you do like that, you decrease the mortality of some certain diseases, and this come back with a good health for our citizens and other new generation, by the way. And even there is another initiative which is a premature marriage initiatives. So these for discovering or early diagnosis of
hereditary diseases,
it's
very important too,
and infectious diseases, and even psychological diseases. All that contribute to decrease the problems which can be
and to introduce or to present better health service to our people, to our society.
And that consume, by the way, first improve the health of Egyptian citizens, then decrease the consumption of money.
Drugs.
And put Egypt on a map of healthy states.
Let's cross our fingers that we are going, inshallah, all to enjoy good health. Dr. Magdy, thank you very much for your input, sir.
Thank you very much.
Still, we do have a lot more to talk about. Stay tuned. I'll be back right after the short break.